Hello, I will be today reading a questionnaire from the book Posttraumatic Embitterment Disorder. The section A, question number 1. During the last years, was there a severe event, experience that hurt your feelings and caused considerable embitterment? I repeat the question. During the last years, was there a severe event or experience that hurt your feelings and caused considerable embitterment? Question number 2. Did this event lead to a noticeable and persistent negative change in your mental well-being? Did this event lead to a noticeable and persistent negative change in your mental well-being? Question number 3. Do you experience the critical life event as unjust? Do you have the feeling that destiny or the responsible person has treated you unfairly? Section B. Four questions must be answered with yes. During the last month, did you have repeatedly intrusive and incriminating thoughts about the event? During the last month, did you have repeatedly intrusive and incriminating thoughts about the event? Does it still extremely upset you when you are reminded of the event? Does it extremely upset you when you are reminded of the event? Question number B3. Does the critical event or its originator make you feel helpless and dispowered? Does the critical event or its originator make you feel helpless or dispowered? It's actually disempowered. Question number 4. Is your prevailing mood since the critical event frequently down? Is your prevailing mood since the critical event frequently down? If you are distracted, are you able to experience a normal mood? That was question 5. If you are distracted, are you able to experience a normal mood? Section C. The question in this section is only one. For how long have you already been suffering from the psychological impairment caused by the event? And specify this in months. Once again, section C. For how long have you already been suffering from the psychological impairment caused by the event? Specify in month. Section D. Prior to the event, did you suffer from any substantial, relevant, noticeable psychological or mental problems such as depression, anxieties, or the like? And once again I repeat this question. Prior to the event, did you ever suffer from any substantial, relevant, noticeable psychological or mental problems such as depression, anxieties, or the like? Yes or no? There is another questionnaire, and the question number 1 is: during the last years, was there a severe event experienced that led to a noticeable and present negative change in your mental well-being? During the last years, was there a severe event experienced that led to a noticeable and persistent negative change in your mental well-being? Question number 2. Did you experience any critical life event as unjust or unfair? Did you experience the critical life event as unjust or unfair? And obviously you can answer yes or you can answer no. Question number 3. Do you feel embitterment, rage and helplessness when reminded of the event? Yes or no? Do you feel embitterment, rage and helplessness when reminded of the event? That was question number 3. And the question number 4. Do you suffer from any substantial, relevant, noticeable psychological or mental problems such as depression, anxieties prior to the event? Do you suffer from any substantial, relevant, noticeable psychological or mental problems such as depression, anxieties prior to the event? And the next question is question number 5. For how long have you already suffered from psychological impairment caused by the event? Specify in a number of months. For how long have you already suffered from psychological impairment caused by the event? Specify in months. Questions from the section B are the following. Question number 1 is: during the last months, did you ever repeatedly have intrusive and incriminating thoughts about the event? Yes or no? I will repeat the question. During the last months, did you repeatedly have intrusive and incriminating thoughts about the event? Question number 1. Does it still extremely upset you when you are reminded of the event? Does it still extremely upset you when you are reminded of the event? Yes or no? Question number 3. Does the critical event or its originator make you feel helpless and disempowered? I think they repeat the same questions as from the section A. It looks like not a proper questionnaire, but it looks like a draft. Oh, never mind. Question number 4. Is your prevailing mood since the critical event frequently down? Yes or no? And I will repeat the question. Is your prevailing mood since the critical event frequently down? Yes or no? And the last question here, which is question number 5. If you are distracted, are you able to experience a normal mood? If you are distracted, are you able to experience a normal mood? And here I start thinking about that when I'm at work, I feel better. I don't think about my daily life problems or any other problems because the work I do distracts me, and that makes me feel better. The work I do is great. It's escape from all the problems and difficulties that I'm facing in my life. Here is an interpretation of the answers. Let's see if there is something else to read. Maybe we'll start from the introduction, if it's relevant. It doesn't matter relevant or not. Specificity of stressors, transactional concepts, problems with the assessment of stressors, stresses and the onset of mental disorders, adjustment disorders, post-traumatic stress disorder, PTSD, adjustment disorders in clinical practice, treatment of adjustment disorders, Posttraumatic Embitterment Disorder, which is PTED. What I like to read is this case of the patient. So let's start. A 55-year-old man lost his job because of a reorganization of the children's home in which he had worked for many years. He didn't show any sign of mental disorder before this critical life event, but was a rather tolerant and efficient person who was well accepted by the children and by colleagues. In the immediate context of the negative life event, the patient started to develop a persistent disorder with a chronic and deteriorating course with disabling consequences. Symptoms were negative mood, self-directed blame, hopelessness, and multiply unspecific somatic complaints such as sleep disturbance and loss of appetite. The clinical picture somewhat resembled melancholic depression. He also developed phobic behavior and tried to avoid places and persons which would remind him of his former work or confront him with former colleagues or even people who could possibly know about his misfortune. These phobic reactions had a clear tendency to be triggered by over more distant, less relevant stimuli resembling agoraphobia. Constant to depression, he experienced event-related aggression and no impairment in modulation of mood. If he was reminded of the critical event, he reacted with emotional outbursts. If he was made to imagine some kind of revenge on the Western system or his old employer, the patient smiled and underwent a complete change in emotional status, such as thoughts were that the children's home would be bankrupt, or even that the United Germany would lose its economic power. As opposite to findings in depression, fully normal affect could be observed when he was occupied with some distracting activity. The patient was on prolonged sick leave and his marriage was in danger because his status was a severe burden on his wife and because he refused to participate in any social activities. The explanation for his impressive reaction was the matching nature of personal history and belief system on one hand, the type of critical event on the other. The patient had been a social worker in a church-owned children's home. He had therefore always been somewhat distant from the old political system. When the reunification came, he full-heartedly looked forward to better times. In the turmoil of these days, he almost personally made sure that the children's home was not closed. He identified himself very much with the work that he did. The children's home was then taken over by a Western Church affiliation. They now reorganized the home and dismissed several employees. As he was one of the older workers, he was the first to be sacked, while younger and less experienced colleagues stayed in their jobs. This came as a complete surprise to him, as he had expected that his special services would be valued. In the light of many years of good service, in a view of his personal system of values, he experienced this is unjust, hurtful, a degradation and devaluation of what he had built up over the years. The emotional consequence was embitterment. The main characteristics of this case vignette are summarized in a specific table, which is here. The other paragraph is about the post-traumatic nature of the illness, differential diagnosis, violation of basic beliefs, wisdom psychology, and wisdom and PTD. And wisdom is attempt of, it's called wisdom therapy, is attempt to treat the post-traumatic uh, embitterment disorder. The points of wisdom therapy are: wisdom addresses important and difficult questions and strategies about the conduct and meaning of life. Wisdom includes knowledge about the limits of knowledge and the uncertainties of the world. Wisdom represents a truly superior level of knowledge, judgment, and advice. Wisdom constitutes knowledge with extraordinary scope, depth, measure, and balance. Wisdom involves a perfect synergy of mind and character that is an orchestration of knowledge and virtues. Wisdom represents knowledge used for the good or well-being of oneself and others. Wisdom is easily recognized when manifested, although difficult to achieve and to specify. So what I think the wisdom therapy is about it can happen not only to you but to any other person. And the main concept of wisdom is to accept. Explicit theoretical approaches, change of perspective. Change of perspective. Yeah, it's looks like cognitive behavior therapy. Yeah, wisdom in the clinical context. Wisdom and coping with negative life events, where wise people are considered to be capable of dealing with any crisis and obstacle that they encounter. Yeah, and it shows that in contrast, persons relatively low on wisdom did allow external events to take possession of their being. They didn't recognize that it is ultimately not the external event that affects their well-being, but how they react to and deal with the crisis and hardship in their lives. These findings indicate that wisdom comprises competencies that allow the individual to efficiently cope with negative life events and crises. Change of perspective, yeah, I just read about it. Where recognition and understanding of views, interests, motives, and situational contrasts of other people can facilitate an understanding of their behavior and of emerging conflicts. In behavioral therapy, change of perspective is trained by means of role change techniques. Alright. Assessment of cognitive and emotional wisdom, which is, the criteria of these are: change of perspective, empathy, perception and acceptance of emotions, serenity, factual knowledge and procedural knowledge, contextualism, value relativism, uncertainty acceptance, and long time perspective. Let's try to describe each of them. Change of perspective. To what extent does the performance show that the different perspective of the person concerned and recognized? Empathy. To what extent does the performance show that the emotions of the different person concerned are recognized and empathized with? Perception and acceptance of emotions. To what extent does the performance show that one's own emotions are recognized and accepted? Serenity. Again, to what extent does this performance show that different perspectives and arguments are reported in emotionally balanced way? Factually knowledge and procedural knowledge. To what extent does the performance show general and specific life events, variations, institutions, knowledge about life matters, and considered strategies for decision making and problem solving? Contextualism is to what extent does the performance consider the past, current, and possible future context of the life and the many circumstances in which life is embedded. Value relativism. To what extent does the performance consider variation in values and life priorities and the importance of the viewing each person within his or her framework of values and life goals despite a small set of universal values? Uncertainty acceptance. To what extent does the performance consider the inherent uncertainty of life in terms of interpreting the past, predicting the future, managing the present, and effective strategies for dealing with uncertainty? And the last is long-time perspective. To what extent does the performance consider that each behavior can have positive and negative as well as short and long-term consequences, which can also contradict each other? Oh, thank you guys. I'm very hungry now, and that's all for today. And I hope this video will be uploaded successfully. And if you have any comments, or if you don't, never mind. At least I will keep the video for the history of my existence. Bye. Good night.